Stop scrolling. If you're seeing more hair in your brush, on your pillow, or in the shower drain, this video is for you. Whether your hair is thinning, losing its shine, or just not what it used to be, you need to hear this. One small, everyday habit you probably don't even think about could be the hidden cause of your hair damage. I'm Dr. Riz, and welcome to my healthcare channel. Please stick with me until the very end because I am going to reveal something crucial. Your hair problems don't start in the bathroom with a shampoo bottle, they start much, much deeper inside your body. Many people believe hair loss is a sudden event, like waking up one morning and realizing half your hair is gone. That's a myth. The truth is, it's a slow, silent process that builds up over months, even years. It all begins quietly, without any warning signs. The first culprit is poor nutrition, when your body doesn't get the right nutrients. It starts cutting back on non-essential functions, and hair growth is one of the first things to go. Your hair follicles slowly get weaker and weaker, starved from the inside out. Next up is stress. We all deal with it, but chronic stress is like a poison for your hair. It constantly pushes your hair follicles into the shedding phase, called the telogen phase, over and over again. Instead of growing, your hair is just falling out. Then there's hormonal imbalance. This is a huge one, especially for women. Conditions like PCOS or thyroid issues can completely disrupt your hair's natural growth cycle without you even knowing it. Suddenly, your hair growth slows down and shedding increases. Once your hair is weakened from the inside, the external factors come into play and make everything worse. This is where scalp problems begin. Dandruff isn't just annoying flakes. It's an inflammation of the scalp that creates an unhealthy environment for hair to grow. Infections can also damage follicles permanently. On top of that, many of us are guilty of excessive heat styling. That straightener or curling iron might give you a great look for a day, but daily use is literally burning the strength and protein out of your hair strands. And finally, the products you use. Using the wrong shampoo, conditioner, or styling products full of harsh chemicals can strip your hair of its natural oils, leading to dryness, breakage, and further damage. It's a quiet process that finishes off the damage that started internally. So please always remember this one golden rule: a healthy scalp is the foundation for healthy hair. You can't build a strong house on a weak foundation. Now I need you to listen very carefully to this next part. No magic hair oil, no expensive shampoo, no fancy serum can fix your hair loss if your body is not properly nourished from the inside. It's impossible. Your hair's strength, thickness, and shine are a direct reflection of what you eat every single day. Let's break it down. First, protein. Hair is literally made of a protein called keratin. If you're not eating enough, your body can't build strong hair. You can get excellent protein from sources like eggs, chicken, fish, and for my vegetarian friends, lentils, beans, and tofu. Next is iron. Iron deficiency is one of the most common causes of hair fall, especially in women. Iron helps red blood cells carry oxygen to your follicles. Without enough oxygen, they just can't thrive. You'll find plenty of iron in spinach, dates, red meat, and fortified cereals. Then we have biotin. You've probably seen this in supplements. Biotin is a B vitamin that supports hair thickness and strength. You can get it naturally from nuts, seeds, and sweet potatoes. We also need to talk about zinc. Zinc is crucial for hair tissue growth and repair. It also helps keep the oil glands around the follicles working properly. A deficiency can lead to significant hair loss. Chickpeas, lentils, and pumpkin seeds are fantastic sources of zinc. And lastly, for that beautiful shine and density, you need omega-3 fatty acids. These healthy fats nourish the hair shaft and support thickness. You can find them in fatty fish like salmon, as well as walnuts and flax seeds. A balanced diet isn't a suggestion. It's a requirement for healthy hair. However, sometimes diet isn't enough, especially if your hair fall is severe or has been going on for several months. Please do not ignore persistent hair loss. This is your body sending you a signal. In these cases, getting blood tests done is extremely important. A doctor can check for deficiencies and underlying issues. Key tests include checking your iron levels, particularly ferritin, which is your body's iron storage. Also, vitamin D, vitamin B12, and a full thyroid panel are absolutely critical. These tests can reveal the root cause of your hair fall, which allows for targeted and effective treatment. Now let's switch gears and talk about your daily hair care routine because small consistent mistakes here can lead to big long-term damage. First, how often should you wash your hair? For most people, washing 2 to 3 times a week is perfectly fine. Overwashing can strip your scalp of its natural protective oils. When you do wash, always choose a sulfate-free shampoo. Sulfates are harsh detergents that can be very drying and irritating to your scalp. Another huge mistake is using very hot water. It feels nice, but hot water weakens hair roots and can strip away natural oils, leaving your hair dry and brittle. Always use lukewarm or cool water instead, and please never ever comb your hair when it is soaking wet. This is when your hair is at its most fragile and elastic. It stretches and breaks much more easily than when it's dry. Gently pat it with a towel and let it air dry a bit before using a wide tooth comb. Also be mindful of your hairstyles. Tight ponytails, buns, or braids constantly pull on your hair from the roots. This can lead to a type of hair loss called traction alopecia, which can become permanent over time. Give your hair a break with looser styles, and as we mentioned, go easy on the heat tools. Excessive use of blow dryers, straighteners, and curling irons slowly cooks the life out of your hair, leading to thinning and breakage. And if you have dandruff, you must treat it. A medicated anti-dandruff shampoo containing ingredients like ketoconazole or zinc perithione, used once or twice a week, is necessary to control the inflammation and create a healthy scalp environment. Now for the most confusing question I get all the time: oiling. Is hair oil good or bad for your hair? The answer is, it completely depends on how you use it. When used correctly, oiling can be beneficial. Good choices include coconut oil, which penetrates the hair shaft, or a mix of castor oil with a lighter carrier oil like almond or jojoba. Argan oil is also great for taming frizz and adding shine, but here is the correct way to do it. You should only oil your hair once or twice a week, not every day. Apply the oil to your scalp and hair, and then massage it in gently with your fingertips for a few minutes to improve circulation. Do not be aggressive, and here's the most important part: wash it out after 1 to 2 hours. Leaving oil on your scalp overnight or oiling too frequently can actually clog your pores, trap dirt, and worsen dandruff and other scalp problems. More is not always better when it comes to oiling. So what if you've improved your diet, perfected your hair care routine, and you're still losing hair? This is when it's time to consider medical treatments, but please remember, these should only be used under the guidance of a qualified doctor or dermatologist. One common treatment is minoxidil solution, which is applied to the scalp to stimulate hair growth. There are also various hair supplements that can help, but a doctor should recommend the right one based on your specific deficiencies. More advanced treatments include PRP therapy, which stands for platelet-rich plasma. This involves drawing your own blood, processing it to concentrate the platelets, and injecting it back into your scalp to stimulate growth. Another option is microneedling, which creates tiny punctures in the scalp to encourage collagen production and improve the absorption of topical treatments. Again, these are medical procedures and require professional supervision. You should absolutely see a doctor if you experience any of the following red flags: sudden and excessive hair fall that is not normal for you, losing hair in patches, leaving bald spots, severe itching, redness, or pain on your scalp, or if your hair fall is accompanied by other symptoms like irregular periods, severe acne, or unexplained weight changes. These could be signs of a more serious underlying medical condition that needs to be addressed. Finally, I want to leave you with this: hair recovery does not happen overnight. It's a journey that requires patience, consistency, and most importantly, the right approach. Please don't fall for the thousands of fake remedies and miracle shortcuts you see online. They promise the world but rarely deliver. True, long-term results only come from science-based care that addresses the root cause of the problem. Your hair is a part of your health. Treat it with the care and respect it deserves. If this video helped you understand your hair a little better, please give it a like, share it with someone who might need it, and subscribe to the channel for more evidence-based health advice, because healthy hair always starts with the correct knowledge. Thank you for watching.